Good morning, doctor. Kindly introduce yourself.
Yeah, good morning, everybody. I'm Dr. Sarat. I'm a reproductive medicine specialist practicing at Indigo Womens Center Chennai.
Is surgery ever used to treat infertility?
Yes, there are many fertility enhancing surgeries are there. Like when it comes to the man, we will do varicocelectomies to improve the sperm counts. By doing varicocelectomy, we will the intratesticular temperature will be brought down, and which may have a positive impact on the semen parameters. Then the reversal of vasectomy is possible, and other procedures like any blocks, we can do bypass procedures like vasoepididymostomy or vasovasostomy. Then when it comes to obstructive azoospermias, sperms will be aspirated from either from the epididymis or testes for fertilization purpose. If you aspirate the sperms from the epididymis, we'll call it as epididymal aspiration of the sperms, or if you aspirate the sperms from the testes, we'll call it as the testicular sperm extraction. So this previously, in cases of obstructive azoospermia, they were subjected to for surgery, and usually the results are not that great with the surgeries. But with the advent of ICSI, the male factor infertility treatments have revolutionized, and many of these men can look forward for a baby with these assisted reproductive technologies and sperm aspiration techniques. When it comes to the female partner, so the fertility enhancing surgeries include diagnostic hysterolaparoscopy to see whether the female genital tract is within normal or not. In cases of polyps, we can subject them for polypectomy, and in cases of blocks, we'll try to remove the blocks whenever it is possible. And then in cases of abnormal swellings of the uterus like fibroids uterus, we'll remove the fibroids to facilitate the fertility. And in cases of polycystic ovarian syndrome, we do a procedure which is called as ovarian drilling to facilitate ovulation in this particular group of anovulatory women.
Can acupuncture help improve fertility?
Yeah, recently there are some papers in the literature which is confirming the advantage of acupuncture in female infertility treatments. So many centers, they started doing acupuncture after the embryo transfer, are those women who are going for assisted reproductive technologies.
Should couples trying to conceive take herbal medications or vitamin supplements?
In general, vitamins and herbal preparations may not be required because in those men who are taking balanced diets, and there are many papers in literature which is confirming the importance of these micronutrients and antioxidants in case of male factor infertility. Sperms are liable for oxidative stress because of increased antioxidants in the semen. So these men, because these antioxidants may affect the cytoplasm of the sperm, and because of scanty cytoplasm, these sperms are more susceptible for oxidative stress compared to the oocyte, which has a abundant cytoplasm. So those men who are recognized for oxidative stress, those men who have increased amounts of DNA fragmentation, these men may be benefited by putting them on antioxidants or micronutrients.
What is sperm donation?
Medical managements or surgical managements may not result in sperm production. These men may not have an opportunity to have their baby. So these men can, there is one option by called donor sperms for fertilization purpose, and these sperms can be sperms collected from the healthy voluntary donors, which will be frozen. These donors will be screened for infectious diseases and sexually transmitted diseases, and blood group and the physical characteristics will be noted, and these semen will try to match the recipients so that there won't be any ethnical or physical differences in between the baby and the parents.
How does age affect a woman's ability ability to have children?
Yeah, with all the knowledge we have now, the single contributing factor for the success of the any infertility treatment will be the age of the woman. So age of the woman plays a major role, and younger the age group, better will be the results. No, as the woman is aging, her oocytes or her eggs also will get aged, and probably with the aging of the oocytes, the fertilization rates will be less and the implantation rates will be low, resulting in the poor success rates with the elderly age group women. Many centers all over the world may not entertain the women who are above 40 years of age because the success rates are so low. Probably the treatments may not be of cost effective. These elderly age group women can be recommended for donor oocyte programs.
Does athletic training affect the fertility?
Not directly, but with athletics who are participating in the athletic events or who are involved with the major physical activity, what happens, these women may have disturbed hypothalamo-pituitary ovarian axis, which will result in amenorrhea, and this amenorrhea is temporary, and these women will resume their fertility once the physical activities come back to normal.
What is the meaning of egg donor?
Some women may end up in menopause before they could reach 40 years of their age. These women, will call them as premature menopause or primary ovarian failure, and these women will be benefited by egg donation. The oocyte will be taken from a donor, and this oocyte will be utilized for fertilization purpose, and the resulting embryos will be transferred back to the recipient woman who has primary ovarian failure or premature ovarian failure.
Can I decide on gender of the baby?
No, it is illegal in India, and any couple asks for a gender specification, usually they should be discouraged, no? Because in India the rules, the laws are against gender selection.
Will the identity of the donor be disclosed to us?
Usually when it comes to sperm donation, usually we will keep it as confidential because to avoid the future legal problems. When it comes to oocyte donation, usually we will encourage them to bring their own related donors so that legal and medical legal problems will be avoided in this particular incidences, because monetary considerations are not entertained.
What is assisted reproductive technology and how often it is successful?
Coming to the assisted reproductive technologies, ART, as you know, the first test tube baby was born on 25th July 1978. From that time onwards, lot of research, lot of thought process has gone into assisted reproduction, and there are so many technologies have developed from that time onwards. Now these days the assisted reproductive technologies are easily available for the couple, and they are fortunate to have these technologies at their doorstep to realize their dream. To conclude my talk, these days the couples are fortunate to have many advanced technologies are available at their doorstep, and I advise them to come to the infertility specialist at the earliest so that they can have their baby at the earliest. So, but at the same time, I say we should not overtreat the couples because the facilities are available. Because I always stress on the individualization of the treatments, and according to the patient's needs, we should treat them. Now, because assisted reproductive technologies are available, it is not necessarily we should offer them for all the couples who are is visiting you. Because many a time patients, they do ask me whether they can go straight away for assisted reproductive technologies or ART procedures, because even ART technologies are also not 100% guaranteed. So because of this limitation in the success rates, I always individualize the treatments, and whatever treatments you do, they should be cost effective, and patients should be benefited by the treatments you are providing to the couple.